getting back to the hormones, so we have men who can take testosterone, and once again, it's so important to point out that this is not to build up your muscles so that when you go to the gym, people look and gasp. This is so that you can get normal levels and you can have normal tissue function. So it's not like you're taking mega doses. You're taking physiological doses, a very small dose relative to what many of your bodybuilders might take. When we talk about other hormones, and I know we've talked about growth hormone, but thyroid seems to be another one that people focus on as they get older. I'm gaining weight because I'm low on thyroid. I can't sleep well, I can't tolerate the cold, whatever it might be. My thyroid is abnormal. My mother had abnormal thyroid. She always took thyroid hormones. Tell us a little bit about what happens with the thyroid, and especially if there are things that we need to be looking for as we age.
Well, in general, as one ages, the thyroid hormone levels decline. So it's not unusual for, if you live long enough, for you eventually to need to have a thyroid replacement with a thyroid hormone preparation. And we would give bioidentical thyroid hormone replacement, human identical, or maybe a boost, some supplement. So there is a natural decline. There are some autoimmune diseases that occur with age where the body turns on its own thyroid and kind of attacks it, and because of that, there needs to be some supplementation. The problem with the thyroid is, again, physician interpretation. And there's the two most important hormone components of the whole thyroid screen are what's known as the free T3 and the free T4. And these are the active hormones that actually are active. It's the free T3 that is the most active. In fact, the T4 is referred to as a prohormone, or a hormone that's got to be converted into T3 for activity. So sometimes patients are found to have normal T4s and low T3s, and they have all sorts of symptoms that look or sound just like they're hypothyroid. They may go to one endocrinologist or a knowledgeable doctor who may overlook the low T3 and tell the patient there's some other cause going on. And then another doctor may say, gee, those cold hands, and you look like you're hypothyroid, I think you need a boost, and they may be placed on some supplemental T3. So there's a lot of nuance to this. And so what I could say is that not all patients who have overweight state are thyroid deficient. There are many patients, though, that are thyroid deficient that are not adequately treated, and probably the biggest group is the post-surgical group of thyroid patients. There was an analysis a couple of years ago that showed a good proportion of patients who have had their thyroids removed because of a condition are not adequately being managed with thyroid hormone. So you have to go to someone that knows how to interpret, and endocrinology has always been half the lab tests, interpreting, and half examining the patient and interpreting symptoms and putting the two together and coming up with a prescription. So you're best going to see a physician who doesn't completely rely just on the raw data, but actually examines, takes a history, and comes to a conclusion of whether there truly is likely a thyroid deficiency and can appropriately treat.